Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. Joining us today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Shannon Gurman, Data Analytics Manager for the Milwaukee County Office of Emergency Management. County Executive Crowley, you're up first.
Thank you so much, Sydney, and I hope everybody had a chance to enjoy the holidays. And as we talked about last week, the federal stimulus package, it did pass last week. And although we are a little disappointed that we didn't see anything directly coming to state and local governments, there are a few bright spots in this. First and foremost, local municipalities will have until the end of 2021 to spend down their CARES funds. This extension is helpful, especially as we get contracts signed and services rendered. However, this extension came with no additional funding. And so all of our CARES dollars from 2020 has its name on it for a lot of the dollars. We've allocated more than $77 million that we've received in federal funding to keep our community safe and healthy. And these funds are going to enhance safety measures in county facilities and towards community services like mental health and housing assistance. But more will be needed in the next year to fill this hit that we have taken as a result of the COVID-19 response. And so we'll continue to work with our federal partners to make sure that this happens in the new year. The second bright spot is really our housing assistance. The stimulus package includes $25 billion in rental assistance to protect vulnerable Americans who are at risk of losing their home. And so we expect additional funds to come to Milwaukee County where we will continue to provide eviction prevention as well as mortgage assistance to those who need it most, especially as we approach Wisconsin's cold winter months. And I also want to just say, I want to welcome Shannon Gurman, the Data Analytics Manager at the Milwaukee County Office of Emergency Management. Shannon joins us today to demonstrate the recent updates that we have made to the Milwaukee County COVID-19 dashboard. Since the beginning of this pandemic in March, the dashboard has really served as a go-to resource for county residents. And with almost 2.5 million hits since its launch, the dashboard really provides key information to the numbers of total cases, like hospitalization, as well as deaths in the county, race, ethnicity data, and much more. And the recent updates to the dashboard will include additional data breakdowns for municipalities, as well as age and race and ethnicities. And these enhancements is a step in the right direction towards greater transparency to our county residents so they know what's happening in their own communities. And these are updates that are just beginning. And so in Milwaukee County, we want to continue using the data to make better informed decisions to achieve racial equity and really become the healthiest county in Wisconsin. And so I want to thank you, Shannon, for joining us today. And lastly, I want to wish everybody who celebrates a happy Kwanzaa and a happy early new year, Habari Gani. While the way that we celebrate the holidays will once again be different, let's understand that we need to have some type of hope as we lead into the next year. And so one way we can do that is to celebrate by being safe with one another and making sure that we celebrate with those who are within our household. And so the safest choice that you can make in choosing to celebrate is with folks again in your household. And so as we remember going into this new year, no matter what you do, remember the 3 W's, which is wear a mask, wash your hands, and watch your distance. And let's make sure that we get this new year off to a healthy and hopeful start. And so with that, I just want to say I'll hand it off to Mayor Barrett and happy holidays to you, and hope you're enjoying the last few weeks of this year.
Well, thank you very much, Mr. County Executive. Good afternoon, everyone. I want to start off by sharing with you that the City of Milwaukee mobile testing for COVID-19 has begun. In addition to the Miller Park site, the Northwest Side Health Center, and the South Side Center, we have now implemented, beginning today, our mobile test site on the north side. We'll have a second unit on the south side. We had hoped to have some more information on that today. That's not ready yet, but we will have a unit. Both of these units will be throughout the city where the need is the greatest. But our first site for mobile testing is Barack Obama School, located at 4300 West Fairmount Avenue, which is essentially Sherman Boulevard, the old Custer High School. And the site opened this morning, and testing will continue there for at least 2 weeks. What we'll do after that is we'll analyze the numbers as to where we need it most, and we'll be able to move it there. But as soon as the health department sees higher levels of COVID-19 illnesses in particular parts of the city, the mobile testing locations can be moved to those locations. So what we want to do is we want to make sure that we are maximizing the ability for people in the most affected areas to be tested. The hours for mobile testing are 8 a.m. to noon during weekdays and from 10 a.m. to 3 p.m. on weekends. Now, what's a little bit different about this is that mobile testing will be conducted by a private company that is under contract with the city. People will have their test results within days, and the testing will be provided at no cost. But unlike other city testing sites, the private vendor will bill a person's health insurance. The city, using the federal funds that the county executive alluded to, will be the payer of last resort if private insurance funding is not available. So again, the message here is first and foremost that the testing will be provided at no cost to you as an individual. Again, they're going to try to bill your insurance company, and if that is not a fruitful way of getting the payment, we will use the Federal CARES Act money. We are planning for additional mobile testing sites on the south side, as I mentioned, and more information will be available as soon as we have it. Now to the testing update. Last week, we were talking about the lack of testing that's going on in the city. And I think given the fact that we had the busy holiday over the weekend, we did see a pretty strong Monday in terms of testing at all three of our locations. At Miller Park, we had 1,930 people go through there. On the Northwest Health Center, we had 545. And on the south side, we had 445. So we had almost 3,000 people on Monday alone. I will note, and I don't know if this will reach people, but in anticipation of inclement weather, the COVID testing site at Miller Park will close early today at 4 p.m., again, because of the bad weather that's coming in. On December 30th, the Miller Park testing site will open late at 1 p.m. to allow a sufficient time to clear the snow. So again, it will be open tomorrow, but it will not open till 1 o'clock tomorrow because of the concern of the weather conditions. I want to also echo the words of the county executive by reminding everyone to continue practicing safe behaviors this holiday season. Don't let your guard down. Prioritize virtual gatherings over in-person ones. Keep up with all safety measures like frequent hand washing, social distancing, and wearing a mask in public. If you are experiencing symptoms or have been exposed to someone who has tested positive for the virus, please take advantage of testing available throughout the city or through your healthcare provider. And I want to join the county executive in wishing everyone a safe and healthy new year, and be safe. That's what we're asking. I want to talk a little bit about the dashboard, give you a dashboard update. I was pleased to see that the state announced a new website that includes some preliminary vaccine data. This will be helpful information as we continue our efforts to provide the public with the most up-to-date critical data in our efforts to address the pandemic. Finally, I want to give a big thank you to the team at the Office of Emergency Management, especially Shannon and Dr. Weston, for making great improvements to the county's COVID-19 dashboard. I can tell you that I rely on this extensively. My wife would say I'm addicted to it because I'm always checking whether it's the testing, whether it's the cases, whether it's the location, whether it's percent positive. It's something that has been very helpful to me, not just personally, but as we form our policy. So with that, I want to again thank Shannon and Dr. Weston, and I'll turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. I appreciate that. Good afternoon. First to our numbers, we have had 83,384 confirmed cases of COVID-19 in our community and 869 individuals who died in Milwaukee County. When we consider trends in our county and how COVID is impacting our community, we look to the Milwaukee County COVID dashboard. It's one of the most comprehensive and transparent dashboards in the country. This publicly accessible tool has been available since the pandemic began, with continuous tweaks and enhancements to better serve our various stakeholders. And that is why thousands and thousands of people continue to visit the dashboard each and every day to understand how this pandemic is affecting our community. How many cases, hospitalizations, and deaths? How is it impacting the most marginalized among us? How are our health systems holding up? Where are the communities of concern arising on the SAFER model? And how are we trending as we look to the future? Shannon Gurman will join us shortly. Shannon is the Milwaukee County Office of Emergency Management's Data Analytics Manager. And she, along with Dan Pojar, our EMS Division Director, and Zach Swingen, our Geographic Information System, or GIS specialist, have been really the brains and the workhorses behind this essential tool. Shannon will discuss the latest additions to the dashboard, a new tab allowing for municipal level understanding of differences in disease burden by age group to inform back to school decisions, as well as by race and ethnicity information to inform resource allocation. Milwaukee County declared racism a public health crisis about 1.5 years ago. And the last 9 months have brought that crisis to a head and demonstrated the importance of data transparency, particularly related to issues of equity, to inform resource management. On that note, as the mayor mentioned, we were encouraged to see the state posting vaccine information today on the DHS website, a critical step toward vaccine data availability and usability for resource management. So we look forward to hearing more from Shannon shortly. And with another major holiday in the past and the end of the year approaching, some retrospect may be necessary. As many of us struggled with decisions of whether to gather with loved ones this last week, we know that for the families of the 869 people who died of COVID this last year in Milwaukee County, that choice just wasn't there. They had an empty chair at their dinner table that will not be filled again in 2021. And for the 295 folks struggling with COVID in the hospital right now, there was also an empty chair that they're fighting so hard to ensure is filled again next year. If you've not lost someone close to you from COVID, you can consider yourself lucky. But as we close out this difficult year, we must remember that COVID was not our only challenge. So far in 2020, Milwaukee County saw 479 people die from drug overdoses, 216 individuals murdered, and 106 die in car accidents. Each of these are record high numbers for the last 2 decades of data management. And knowing that mental health challenges from isolation and economic strain inherent in this last year, we also saw 122 people take their own lives through suicide. It's been a hard year for so many reasons, but there are also reasons to be hopeful. It's been a year when we've seen government, healthcare, EMS, and public health pull together and aid their community as never before. It's been a year where we've seen healthcare providers, first responders, and essential workers making sacrifices, but at the same time receiving the recognition for the work they've done tirelessly, day in and day out for decades to keep our community functioning. And we all have certainly recognized how precious our time is with friends and family, time that we previously took for granted. Now, none of these is a consolation for the challenges that we've all felt over the last year, but it's important to take stake in that which we've gained in addition to that which we've lost. We enter this new year facing a tremendous national disease burden, but also with a newfound hope from the vaccine. The next few months will certainly not be easy. We have ongoing COVID fatigue among all segments of our population. We have much to learn of the concerning new variations of the virus being discovered around the world, and we have a long winter ahead to maintain physical distancing and preserve mental health. But we all face these challenges with the knowledge that a vaccine is currently being widely disseminated and light can be seen at the end of the tunnel. We've shown together over the past month that individual behaviors in avoiding gatherings and maintaining masking and distancing can drive down our numbers. We must continue this vigilance if we're to emerge from this pandemic with as few additional lives lost as possible. Thank you very much, and with hopes for a better new year, stay safe. And I'll hand it off to Shannon Gurman.
Thanks, Dr. Weston, and thanks to everyone for such a warm welcome. As mentioned, I'm Shannon Gurman, the Data Analytics Manager from the Milwaukee County Office of Emergency Management. The Office of Emergency Management has played many important roles in the COVID-19 response, and one of those is through data analytics. I'm happy to be here today to talk about our Milwaukee County COVID-19 public-facing dashboard that a small team has worked tirelessly on with the goal of transparency, providing general awareness to the public, and to inform our community's response through data. In the very early days of the pandemic, we made a firm commitment to empower our community with the same data that our local officials are using to make decisions. So as mentioned by the county executive, this dashboard launched on March 19th of 2020, just days after the county's first positive case. To date, we've had approximately 2.4 million views, both locally and nationally, ranging from community members reviewing the data to decide when they will venture out to the store for groceries, to local officials utilizing the data to target messaging and resources, and lastly, to researchers working to understand the burden of the virus on various communities. We have continued to add to this dashboard as COVID-19 has unfolded, and today I'm excited to share that we have further built it out to provide a whole new level of information to our various audiences. So I'd like to take some time to share my screen and walk you through those ads. Give me one moment. Okay, so here we're looking at the landing page of the COVID-19 dashboard, and this is likely very familiar to many people. However, if you are unfamiliar, we look at total confirmed cases in the county, total hospitalizations, and then total deaths across the county. We then break those metrics down by specific demographics like race, ethnicity, age range, gender, and then the municipality. And then we also look at those trends over time to see the trajectory of the virus in Milwaukee County. We also do some geospatial analysis that looks at the distribution geographically across the county. We provide many different pieces of data across this, but I'm going to skip ahead to the new ad that we have on our dashboard that just released. So you can navigate to the municipality trends tab. And when you get here, you land on a page that looks at positivity rate, total COVID-19 tests administered per 100,000 residents. So it's a rate, new positive cases, and then total COVID-19 tests administered. And these are all data points that are shown over time by week, so you can see the trends over time. Across the top, we have a date range selector, so you can really hone in on a specific time frame of interest. And then also you can select the municipality that you would like to view. So in this case, I have all municipalities selected, but you can select just one to look at, or you can also select a handful. It's whatever you choose to do. On the next page, we are looking at positivity rate and total COVID-19 tests, again, over time by week. But we have some different selectors at the top. So we have a date range selector. Here again, you can select the municipality that you would like to review. But here we also have age range and then race ethnicity. On this specific breakout, when you select your age ranges you want to view, you will be able to see the breakout of age ranges by these two metrics. So each line will represent a line such as 0 to 9 years, 10 to 19 years, and so on and so forth. Our last page here is very similar to the age range breakout. However, here we allow breakout by different race ethnicity categories. And so again, you can select your date range, you can select your municipality and your age ranges, but each line will represent a different race ethnicity group. So now that we've dug into the specifics behind the new ads on the dashboard, I want to show one example of how this data can be used. Throughout the pandemic, there has been much discussion about the disproportionate impact on different racial groups in the county, one of which is the Hispanic community. So with this new set of tools, we can now drill down to see trends over time in a very specific way. So on this page, we are zeroing in on 4 different groups. We're looking at the Asian community, Black community, Hispanic or Latino community, and then also the white community, and we're comparing those against each other. As you can see, and we have talked about many times throughout the pandemic, the Hispanic community is trending much higher in terms of positivity rate, and therefore the burden of disease in that community. We can then drill down even further and go back to our age range tab, and we can ask the same question about what is the age range breakout in terms of burden of disease in the Hispanic community. So here, I'm going to select the race ethnicity category, Hispanic or Latino. And now we can see that in our very peak in mid-November, all age ranges were between 25 to 30%, some spiking up to 40%, which is much higher than the average we were seeing across the county. The average positivity rate across the county was 19%. And if you ever want to see the average positivity rate, you can go back to the testing data tab and review that there. When we go back even further in our data to looking at the week of 7/26, so back in July, we have a positivity rate for all age ranges between 10 and 20%, while the average positivity rate across the county was 6%. So again, this is a great example of how this can be used in highlighting the disparate impacts of COVID-19 across the county. And we encourage people to spend some time exploring this tool. So to wrap this up, you can see that this increased detail really does highlight the disparate impacts of COVID, or it might specifically help a parent decide what method of schooling they'll select for their child, whether that be in-person, hybrid, or virtual, or help the equitable distribution of the vaccine. In the meantime, our team will continue to share the most relevant information we can through the dashboard. I thank you for your time today and turn it back to Sydney.
Thank you, Shannon. Our first question comes from Nick Bohr at WISN 12. The question is we'll have Dr. Weston try this one. What is the plan for getting the vaccine to EMS workers, paramedics, EMTs, and firefighters?
Yeah, I appreciate the question. So this is a major issue. So EMS providers are essential healthcare providers in our community. And as their medical director, I can tell you that in Milwaukee County, our nearly 1,500 firefighter EMTs and paramedic have over 100,000 patient encounters every year. And they serve our Milwaukee County population of nearly 1 million. But now, unlike other health providers, they frequently operate in confined and uncontrolled environments with patients known or suspected to be COVID positive. And they've done this day in and day out, 24 hours a day, 7 days a week, without complaint during the pandemic, well before the pandemic, and they'll continue to do it in the future. These EMS providers in Milwaukee County and in the state and the country for that matter, they're in the 1A phase of vaccination. That's for good reason. And we're working hard to make sure they get the vaccine as soon as possible. So the local health departments are the main avenue for them to receive vaccines. I know our local health departments, our local health officers, they've been working tirelessly to obtain vaccination to immunize these frontline providers, as has our Office of Emergency Management. So we continue to work with the state, with our local coordinating vaccine work group to help with that process, to just get vaccine to our local health departments, to our EMS providers, and vaccinate really these most frontline of our frontline providers.
And just to follow up on that from the city standpoint, Acting Chief Lipsky has been in communication with the health department. And the way the process works, the city of Milwaukee has been designated as a vaccinator. And so it's now in the process of putting in the paperwork to the state, requesting a specific number of vaccinations. As Dr. Weston said, firefighters, EMTs are in that 1A category. And so our hope is that we will get permission for that as early as later this week, that it'll get approved over the weekend and that we can start that next week. That's not a guarantee or a promise, but that's the best case scenario right now, because the process has begun now that allows us to request an allocation from the state. The state will make that determination, get it to us. But for the city of Milwaukee, and as Dr. Weston said, I think throughout the state of Wisconsin, EMTs are in that top category for the very reasons Dr. Weston mentioned.
Thank you. Our next question is from Rebecca Klupp at TMJ4. The first part of the question was around the EMTs and vaccination rates. Overall, only about 30% of Wisconsin COVID vaccines available have been given out. Dr. Weston, do you have any insight on the delay? Oh, you're mute.
Sorry, I would defer that question to the state to comment on the vaccine distribution.
Thank you. Next question comes from Kent Wainscott. And for you, Dr. Weston, Kent would like to ask his question on camera.
Dr. Weston, how are you? Listen, we learned yesterday that a local hospital had to discard 50 vials of the COVID-19 vaccine because someone mistakenly left it out unrefrigerated too long. Maybe the kind of human error that the vaccine handling protocols didn't anticipate. So I have kind of a two-part question for you. Are you confident in the system of handling and storage of the vaccine? And should all hospitals be reviewing their own procedures for handling the vaccine after seeing how a mistake like this can happen?
Yeah, so I saw that in the news as well. It certainly is unfortunate. I think to answer your question, I think the first answer is absolutely. All hospitals should be reviewing their policies and practices and health departments and anybody else receiving vaccine. It's a complicated process. The vaccine has to be stored at very cold temperatures. It has to be used within a certain time period once it's thawed out and once it's taken out of the freezer. So certainly looking over those policies and procedures, doing quality oversight on that is going to be important. Now, to that poor person who took the vaccine out of the fridge, human error occurs. And if any of us have worked in a business setting or in a community setting where human error hasn't occurred, then you're pretty privileged. I work, as I said, with almost 1,500 EMS providers. I work in an emergency department myself. Human errors occur. And so something like this happens. It's very unfortunate, but we understand why it happens. We look at how we can make it better in the future, which is just what you outlined, getting those policies and procedures in place.
Thanks.
Our next question comes from Brittany Lewis at CBS 58. Do we know when any health departments in Milwaukee County might receive the vaccine to help vaccinate EMS workers? Are there any other efforts on a county level to vaccinate EMS employees?
Sure. So the state would be able to answer who's getting the vaccine when exactly. I believe local health departments are going to start getting it either now or in the next week. So we'll certainly watch for that. And certainly there are other efforts. The Office of Emergency Management is helping to coordinate vaccine efforts. And as health departments have excess vaccine, the intent is to get the shot in the arm of 1A providers as fast as possible. So however we can do that, we'll certainly be up for it. But I know the state is could answer the question on local health departments.
Our next question comes from Kim Shine at CBS 58. Though Monday was strong, are health leaders and city county leaders still concerned about the dip in testing numbers after the holiday? What do you still want people to keep in mind when it comes to continued testing?
Get tested. How's that for cutting to the chase? We want to see people get tested. It's that simple. And that's why we're making the efforts to actually expanding our testing capacity, because we continue to believe that this is one of the best ways to track the disease, to monitor the disease, and to control the spread of the disease.
I couldn't have said it better. Get tested. I mean, this is one of the reasons why we're talking about the dashboard, so we can be able to have the data to respond better. So we need folks out there to understand that the holidays are here and we need people to continue to get tested.
Yeah, absolutely. And when we look at the numbers, we do see a fairly steady level of testing, but it's lower than it's been in the past. And for this time of winter, colds are going around, a lot of viral illness is going around, and it's really impossible to tell the difference between a simple cold and COVID just by the symptoms you have. And so anybody with symptoms at all consistent with COVID, which can be mild cold symptoms, need to get tested.
Thank you. We're going to jump back to a question from Taryn Powell from WUWM for Mayor Barrett. Are officials aware of the number of people who are uninsured in the city and county, and will CARES funds be used for them as well regarding mobile testing?
Well, as of last year, according to the Affordable Care Act, there were approximately 69,000 uninsured people in Milwaukee County. And it is our intention to use the CARES Act money to provide for the testing. I know there's another question as to whether we're going to limit the testing at the mobile sites to City of Milwaukee residents, since we are using CARES Act money. We haven't made the decision, or we haven't made a decision at any of the testing sites to limit them to City of Milwaukee residents. And the reason for that is the Affordable Care Act money is actually federal dollars. And so we think it makes sense for us to use that for people who need it. Obviously, as the mayor of the city of Milwaukee, I want to make sure that that the people in the city of Milwaukee get tested. I also want to make sure that the taxpayers in the city of Milwaukee aren't carrying an undue burden. So if we see a situation with the new sites where the Federal CARES Act dollars are being used up, obviously we'll have to reevaluate to make sure that local taxpayers are not carrying that load. But as of right now, what we are doing is we are going to continue to focus the mobile test sites in those neighborhoods, which are located in the city of Milwaukee, where we're seeing the highest outbreaks. And we think that that in and of itself is going to control the problem of having too many people from outside the city get tested in those locations.
Our next question is from Sharon Bagenda at CBS 58 for Dr. Weston. Any concerns with Christmas, New Year's surge? What do you suggest travelers do after returning from Christmas gatherings? Do you feel people were more lax for Christmas than they were for Thanksgiving?
Yeah, thanks for the question. So anytime there's a gathering, of course, we worry for a spread in cases. And I think as far as the laxity that there may have been around Christmas as compared to Thanksgiving, we see this cycle where when the disease burden is high and our hospitals are getting crowded, we hear more about COVID. We talk more about COVID and the precautions tighten up. People are more vigilant. And that can be reflected in testing. More people get testing. That's part of the vigilance of COVID precautions. And so as we see that decline in testing, it suggests to us that individual precautions are perhaps getting more lax too. And so I don't have, perfect evidence to say more people gathered for Christmas than they did for Thanksgiving. But with the disease burden being down, which we're certainly thankful for, there is that concern that people will loosen up a little bit and we'll get back into that cycle where we rise up in the disease burden. Hopefully we won't, but that's certainly a concern.
Our next question is from Allison Durr, the Milwaukee Journal Sentinel. For Mayor Barrett, was Curative selected in a competitive bidding process, and how much is Curative charging per test?
There are not a lot of companies or businesses that are involved in this effort. So it was a negotiated agreement between the health department and Curative. I don't have at my fingertips what the amount is, but again, we're happy to get you that information. But it did not go through a bidding process. It went through a negotiation process. Again, in part because of the lack of providers. And secondly, obviously the press of time really dictates that we're trying to get the testing up and running as quickly as possible.
A follow-up question from Allison Durr. Does the city currently have equipment to store the vaccine, or will the city need to make additional purchases before it can begin acting as a vaccinator?
A very good question. As we all know, the Pfizer vaccination is the one that needs a special refrigeration or freezers, and Moderna does not need the same level of coldness. But we do have the capacity, and we're also looking at other potential places if we need additional storage locations. So we don't anticipate at this juncture that that's a problem, but obviously we're doing everything we can to make sure that it's not a problem.
And that appears to be our last question, our last call for questions from the media for our panelists. All right, everyone, thanks again for joining us today. A reminder, there will not be a briefing this Thursday. Our next briefing will be on Tuesday, January 5th. Enjoy your holidays and stay safe. We'll see you back here next week. Thanks, everyone.
Happy New Year, everybody.
Happy New Year.
Thank you. Happy New Year.